Yeah.
Okay.
All right.
Max, are you going to kick us off?
I'm going to kick us off. So welcome, everyone. I'm Max Claremont with the Chicagoland Vaccine Partnership, and really excited to facilitate and moderate this conversation with our community leaders. I'm a senior project lead with Partners in Health and help manage the work of the Chicagoland Vaccine Partnership. And our goal as a coalition of over 150 organizations is to, across sectors, is to mobilize resources and facilitate the education of information about the vaccine and science. But our big thing and what we hope to get out of this conversation today is elevating and lifting up the coordination that happens and the collaboration that makes this work possible. It doesn't happen by accident. It takes intentional focus. It takes heart. And I think you're going to learn a lot about that today. And so we're joined by Mr. Emhoff, the second gentleman, and Dr. Webb, who's a policy advisor with the COVID response team at the White House. And I'll have you all kick it off with just some intro remarks, and then we'll introduce the panelists.
Great. Well, Doc, you want to kick it off as we always do when we're doing these events?
Indeed, yeah.
He is a hard act to follow. I will try, as always.
I don't know about that. You know, it's so great to be in this conversation because, you know, in so many ways, community is what informs everything that we're doing in this COVID response. And, you know, when we talk about my work is around equity. And when we talk about equity, it's about really building a response that serves everybody's needs and that acknowledges that health doesn't happen in the White House or in hospitals or in clinics. It happens in community. It happens in the places where we're born, grow, live, learn, eat, play, and pray. And if we start there and have these conversations, that's how we'll find our way through this. That's how we'll find our way to the right solutions. And you really have to have a listening and a learning posture. And that's why I'm excited to be a part of this conversation today.
Great, thank you.
Thank you, Dr. Webb. It's so great to be here. It was nice to meet you all backstage just for a minute, but I'm looking forward to this conversation and really to listen. I've been doing this second gentleman job for 5 or plus months, and I've spent most of my time on the road. I've been to 18 or 19 states, and I've held numerous listening sessions on COVID, other issues, small business, you name it. But it's the best way to see what's really happening in the community and then just take it back to, you know, I'm married to the vice president. So when we have dinner, it's like, hey, honey, how was your day? Well, and then when I see the president, and also we're in very close coordination with the COVID team. And you find things that, as an administration, you just don't know until you're actually on the ground and you hear from the folks doing the work what is needed, and then we try to respond to that and take it back to the community. But on picking up on what Dr. Webb said on community, that's exactly right. I saw it with the young people out here today, the volunteers, all over the country. I was down south last week, but I've seen it all over the country where you have various elements of the community, whether it's the health community, the religious community, the school community, the state, local, federal government, volunteers, the barbershop. We were at a barbershop this morning, small business. Everyone just came together to fight COVID, and they've stuck together through thick and thin. And now that we're getting to this point where we've got the vaccinations and we're really working hard to get the shots in the arms, and we're close, but we're not quite there, and we'll talk about how to get over the hump. That's what I'm so excited about moving forward. That I don't think these groups are going to all of a sudden split apart because COVID's over. I think they're going to be stronger and stay together and stick together as issues face us as a nation. And the other thing I'll end on before we kick it off, this is not political. I've been saying this all over the place. This is not political. Nobody's talking about Republican, Democrat, not once where I've been all over the country. It's the same word, it's community. I'm doing this for my community. I love my community and I want to give back. So with that, Max, I'll take it back to you and introduce everyone else, and we'll have a conversation.
Excellent, excellent. All right, so we'll start with Gloria. So introduce yourself and a little bit about your organization, but don't drop all the gems.
Hello, everyone. Thank you for having me here. It's an honor to be here to talk about
the challenges that I face with vaccination in my community. My name is Gloria Williams. I'm the founder of Voices of West Inglewood. And Voices of West Inglewood is an organization that is resilient, but is also bring residents and community stakeholders together to bring awareness among what's going on in our neighborhood. It was a struggle, a trust factor with African American in getting the vaccination. So going door to door, having conversation, answer some of the questions. If I couldn't answer it, I'll always direct them to the website. I go review the website myself, maybe call a few other people to help them to explain to me so I can be able to relate it to the community. By knocking on the doors, I'm building a rapport with the constituents, with the residents, with brothers and sisters, family, as well as building a relationship. Then I build that relationship, then that's when the trust come in. Being honest and being truthful about why we should take the vaccination. And then some of them still bring up, you know, the syphilis experiment.
Yeah.
And I kind of, you know, understand why that we do not trust vaccination because we don't know. The most important thing is we have to educate. Once we educate, then we can expose them to the things that they need to know why it's important to take the vaccination. And then when they come out with the negativities with the Johnson & Johnson, those who did have second thoughts, now the Johnson & Johnson, because they would have took the first shot, now you put them back in the first step again, and not trusting, they don't believe. So, yeah.
So, before we move on, I know Dr. Webb is probably going to want to answer respond to you on what you just said, because I've heard him speak to this before. Dr. Webb, do you want to address that point?
Yeah, you know, two things, because the first you mentioned, and you're so right, you said we have to educate, but what I would say is that there's already an education that's taking place just in the life experiences and the perspective that folks have. We actually have to listen and deconstruct, and I think that's really your first step that you're already doing. And you have to deconstruct some of those myths, some of those concerns. And you mentioned the Tuskegee syphilis study, and that's one that, you know, we were down in Alabama talking about this just the other day. And what is really so interesting about that is that the dynamic from 1932 to 1972 was that they were withholding life-saving interventions from black men, and that was the tragedy. Well, in this instance, the life-saving intervention is the vaccine, and the tragedy is when that's withheld from our communities, right? And so it's so important that we deconstruct some of those stories, some of those narratives, and that we reframe it so that people realize actually the response, the recovery, the rejuvenation in the wake of Tuskegee is making sure that our communities have access to this life-saving intervention.
I can speak to that, but you know, I agree, because what would prevent a lot of that black and brown who was hit the hardest is that we're not educated about our health. I work with a group of seniors, and we have seniors who don't know how to read. If we know how to address these deficiencies in our body, it can fight off a lot of these diseases that we had, and maybe it probably would prevent some of this pandemic in our community. Education is the key. I would challenge the health community to start having these conversations about the deficiencies of our body that can prevent some of the challenges that we have as far as our health.
And that's a great point, just using the vaccination moment as an opportunity to engage the other health issues that people have. Antonio, can you talk a little bit about your organization?
Yeah, of course, thank you. My name is Antonio Santos, and I'm a co-founder and executive director of the Gage Park Latinx Council. We are a queer, DACA-led grassroots community cultural center here on the southwest side of Chicago. Our organization has only been around for 3 years, but we've been able to have a lot of great impact because we've been building trust on the ground with our neighbors over the last 3 years. So when the pandemic hit, folks naturally came to us. with their concerns, fears, needs. And so we mobilized quickly around those needs, one of them being food insecurity in the midst of the pandemic. We've been operating a food pantry here in the community for a year and a half now, with no plans to stop in the near future, because we know food insecurity is deeper rooted than the pandemic and this moment. Along with that, a large population here in Gage Park, a 92% Latinx community. A lot of folks were undocumented and didn't know who to trust around getting medical care and access, if they qualified, if it would be free, if things were translated in Spanish. And so we've been organizing with the undocumented community in Chicago as well to make sure that they have access to those resources. We're really proud to have a grassroots community-led cultural space here on the Southwest Side that has been partnered with Esperanza to open this vaccine site that we're at now. We actually have 2 of our staff members working the tables out front. So when folks come into our center, they can book a appointment directly through us, through folks that they trust and know. And then when they come here to check in, they again see familiar faces that they trust and know. And that's been one of the points that we've been really successful at, being able to get our community vaccinated despite hesitation that is very valid.
Yeah, and what's great about from Gloria to Antonio, a lot of the education work, but there's also, once they say yes to the vaccine, there's issues around access, right? Booking appointments, making sure the folks who, yes, I'm ready to take the vaccine, here's where you need to go. And I think a glue to a lot of that work is the work that Carmen does here at Esperanza.
Good afternoon, Mr. Emhoff, and welcome, Dr. Webb, as well. My name is Carmen Vergara. I'm a public health nurse and Chief Operating Officer at Esperanza. Welcome to the Southwest Side. We're excited to have you here and hear our story, and I really appreciate you saying that you were here to listen and hear our story. We've been doing so much work over the past year and a half in collaboration and partnership with community-based organizations, and we are in a moment of healthcare transformation, and I think that of everything, there is a silver lining and an opportunity to redesign, reassess how healthcare operates, and really looking at a stronger, wider reach for patients who are in need. We are a federally qualified health center. We have been doing so much of the heavy lifting across all FQs in Chicago, and we're really fortunate, that there has been, funding allocated for FQHCs, because we really feel like we can mobilize. We have the trust within the community, and we have the quality of care that patients, deserve, and in a respectful way that's tailored to their culture. And so our patients specifically, 70% prefer their care to be delivered in Spanish. And so that effort for us to make sure that we are being, culturally relevant and helpful for their patients is something that we find very important. So, welcome.
Great. And so I'll start with a couple questions, and we'll start with you, Carmen. So in your title, it's operations. And so I'd love for you to talk about the work around operationalizing equity, right? Like Dr. Webb, who has a focus on equity, what does that look like? From site selection that we talked about before, from how people can access and book appointments, and even your engagement with the Protect Chicago initiative that really had an intentional focus on the hardest hit neighborhoods, and how important it was for you to reach back outside the walls of the hospital to build relationships with communities. So I think operation, it's not just a checkbox. There's a lot of kind of work and hustle associated with doing that work. So if you could talk about the work that Esperanza has been doing around that.
Sure. I think healthcare equity is important to us, important to our mission. We had to be very thoughtful of the vaccine rollout to make sure that we were administering vaccines into the right arms. We serve the southwest side of the city of Chicago, and it's been the hardest hit area in Chicago, and so we knew that we needed to be prepared, we needed to be organized, we needed to have a strategy, we needed to have partners. And so for us, it was really thinking about how do our patients get access to us, and online booking is not going to work. And so we were really thinking about what is the easiest way for patients to reach out to us. And one of the first biggest strategies that we did is we created a text messaging platform. Most of our patients, for the most part, have cell phones. They're comfortable with texting, and they would text us the word vaccine. And through that effort, we would call them within 24 to 48 hours, and we would book appointments for everybody in the household. And that way, we had all entire families coming in on the same day, same time, just one step to get their vaccine. And it was just the efficiency in that was so helpful for our patients. They don't have to take multiple days off of work, find transportation. So all of those efficiencies, being thoughtful in that process is something that really helped. We also, I think, knew that if we really wanted to make impact, we needed to have multiple mass vaccination sites. We know that here on the southwest side of Chicago, there are healthcare deserts, and our president and CEO, he drove around to find this location. He went in his car and was looking to see where would be a perfect place for a mass vaccination site that could really equal the impact that we were trying to make. So this place was unoccupied for a couple of years, and it was just sitting here as an empty resource. And so we set up shop here, and we've been vaccinating thousands of patients. So for us, we really wanted to make sure that we were accessible, that folks can walk to our home, that they could easily find transportation here, that access to an appointment wasn't going to be a barrier. So we make sure that all of our staff are bilingual, they can speak the language, and that they really understand who we should be vaccinating. The Protect Chicago Plus program was crucial for us because this is where the Chicago Department of Public Health and the mayor's office were ensuring that we were getting the vaccines early on where supply was limited. So that decision was the most critical because we were getting vaccines to the areas hardest hit. So the folks who really needed the vaccines. And that decision was huge because we are now reopened in Chicago. And now the economy is starting to, roll out again. And I think that it's because of the Protect Chicago Plus forethought of really making health equity a top priority.
Great. How are you getting to the folks who are still not there yet on getting the vaccine? And that's really for both of you.
Mm-hmm.
If Antonio wants to take that.
I think that for folks that still have hesitancy, it's not an overnight process. We're engaging with these folks at our center and in our community, at the bakery, at the hair salon, wherever, day after day. And, really just answering questions and also giving them gentle nudges and reminders of why it's important. Because I think that as Chicago opens up, it can be a little bit misleading for folks who haven't been vaccinated to think this is over, we're ready to get back out. And so letting them know that this isn't over, there are variants out there, there are still a lot of folks at risk, and that it's important for you to do that. Right now we're seeing that with a lot of youth and younger people as vaccines opened up later. And trying to use our influence with them and our space and our programming to really push through with a trusted voice that this is important, it still needs to be done.
You're saying exactly what I'm trying to say all across the country, so thank you.
Well, and just a quick question for all of you, because what I'm hearing is the kind of wisdom that ends a pandemic, right? I mean, what you're seeing, what you're hearing, what you're experiencing on the ground, you didn't need a large focus group or a ton of data. You hear it and you see it every day. How are you getting that information to the decision makers? How are they coming to you? How are you making sure that the wisdom that I'm hearing around this table is guiding some of the decisions both locally, at the state level, to help support you in your work?
Yeah, I think for me, Esperanza has been a really great partner at putting trust into community leaders that are already doing this work. And for us, we are really prioritizing working with folks that trust that our lived experiences as residents of these communities, as people of color, are good enough, and that they bring a lot of value. I've seen that with Esperanza. I think that the higher up it becomes, the harder that is to bridge. So I wouldn't say that that's the truth, like statewide or with other elected officials quite yet. But I'm hoping that they learn from this model of what we've been able to build for the future of organizing our communities in many different ways around healthcare, because we know healthcare isn't just clinical, that healthcare is violence, gun violence, healthcare is poverty, healthcare is education and access. And so we're trying to reimagine how that looks here on the ground, and we're hoping that everyone up top kind of pays a little bit of attention. So we're happy to have you both here speaking with us today.
And I said it out at the rally. If you're sick of listening to me or other people in the administration, listen to the community leaders and give you all the tools that you need to not only spread the word, but to access the technology that you need to make the vaccines more available, easy, with the child care, free rides, and all the other things that we're doing to help everyone on the front lines. Gloria.
Well, I agree with Antonio, a lot of the things. I challenge my elected officials all the time when things is not going right in my community. And I have mentioned to them, and they have got out in the community, putting the word out, holding sessions where people can go get vaccination. But what I love the most is myself and my colleagues, who are all the people that's actually in the trenches.
Yeah.
Just going out there, knocking on doors, explaining and taking the time to educate the residents. I still do have challenges, but I like to use my story. My story is, I was hesitant in taking the shot. So I prayed about it, and I said, God, you gotta give me a sign. So what brings to my mind is about the man in the boat, the story in the Bible about the man in the boat about to drown. God sent him 3 people. He had 3 opportunities to be saved. So when the young man drowned in the boat, and he finally had an opportunity to meet God, he said, God, you didn't come save me. He said, I gave you 3 opportunities, and you didn't take that chance. So when I thought about it, I said, well, that's the Pfizer, that's the Moderna, that's the Johnson & Johnson. That's my 3 opportunities. So that kind of convinced me.
Wow.
I said, okay, I need to take this shot. And I use that story as I go knock on the doors and interacting with anyone in the community. This is your opportunity to take this shot. And for my illegal pharmaceutical brothers, the Zafir, I talk with them as well. I have real conversations with them. Okay, so what's the difference in you using illegal pharmaceutical drugs and it do damage to your body, but this drug is gonna help your body. So we have those conversations, and by having those real deep conversations with individuals, then they begin to like, okay, let me think about it. Maybe I need to take this shot to save myself. So it's saving me. I'd rather be saved than dying. And this is where the health issue come in. We have these deficiencies, so we got the high blood pressures, the diabetes, and we easy to catch these viruses. So that's my conversation when I'm out in the community, is trying to get more people to be educated.
Okay. I think we have time for one more, Max.
Yes, yes. So just to kind of look ahead to the future, I mean, we've done, there's still a lot of work to do around vaccinations, but alluding to a point that was addressed earlier, what's the opportunity to sustain this engagement, these collaborations, to engage a long-term conversation about the public health workforce? What gives you hope about sustaining this work for the long term, so that when the next pandemic comes, we're not starting from scratch? And I'm crossing my fingers that we don't have another global pandemic, but and how do we use the collaboration, sustain this to address the other issues that are plaguing many of the communities that you all are from and work in? So we'll start with Antonio.
Yeah, thank you. I think that one thing the pandemic has shown us is that grassroots efforts work, that when you fund and add resources to the folks at the bottom and on the ground, that you get a big impact. And I'm hoping that outside of the pandemic, we can start to address all health inequalities in that way by making sure that we are entrusting the people whom we are asking to trust us.
Great. Carmen?
I think it's super important that we don't get caught off guard again in the future. We've seen that with genuine concern, collaboration, and the will, partners can come together and make a significant impact. And I think that we could use this framework and apply it to beyond COVID, but also diabetes, hypertension, and even beyond that to the social determinants of health, to housing, to poverty, to the workforce development. So many areas could benefit from this particular framework of collaboration. And so I really hope that we could keep this momentum moving forward.
Collaboration is important. Resources is important, and education, because without that and being truthful about what's going on and building relationship and rapport is the best thing for a grassroots organization, because they actually in the community making a great impact about what's going on with their neighbor, their family, all of that. Yeah.
Great. And I think the message is important, but the messenger matters a ton. And I think the role that you all have played in the community, the relationships you already have, it's easy for folks to kind of move along the process along their vaccine journey because they know they're listening and hearing a message from someone who they have a relationship with. So that concludes our conversation, and thank you, Second Gentleman and Dr. Webb, for joining us. And hope you take some of this back to the big house.
We're both lawyers. He's a doctor. I'm only a lawyer. He's a lawyer and a doctor. But I write it all down. I'll gather my thoughts, and I'll bring this back.
Thank you.
But it's so great to see the collaboration, and as you're saying, it's not just about COVID. COVID made everything that was bad, it made it worse, and we can't just stop and leave those issues, the other issues that you talked about, food, the economic disparities, all those things, other health issues. We've got to stay together and keep these alliances strong and work on building your community, but in all aspects, health-wise, economically, socially, justice-wise. So this is great. This is such a good group, and you're just doing the work. Makes me feel so good to be a part of this, and I promise I will discuss all this when I get home.
Yeah.
Thank you.
Great.
Thank you.
Thanks a lot.
Thank you all.
Thank you.
Great job.
You got into it.